Thank you, Mr. President. Mr. President, I want to tell you a little bit about Greg Kiesling, a dad and small business owner from Indianapolis. I've gotten to know Greg over the past few years because Greg and his wife, Janet, lost their son, Chancellor, to suicide while Chancellor was serving in Iraq in 2009. Joining a club, he often says he doesn't want anyone else to join. This is Greg. This is Chancellor. This is Chancellor again on duty. And this is the memorial they had for Chancellor. Greg recently said that he sees the invisible wounds borne by our men and women in uniform as one of the greatest challenges our country faces. And he noted, we're going to face this challenge for many years to come. Greg is right. We've lost more troops to suicide than in combat each of the past 3 years. We lost more than 400 active duty, Guard, and Reserve service members last year alone. It is also estimated we lose 22 veterans to suicide every single day. These are preventable deaths. We must do more to get these men and women the mental health care they have earned. We need to remind our troops and veterans, along with our friends and family, that it's okay to share the burden of your personal struggles. It's a sign of strength to seek help. Our service members, veterans, and their families sacrifice for us. So we must do everything possible to support them. Last year we passed, and the President signed into law, the Jacob Sexton Military Suicide Prevention Act. For the first time, it required an annual, in-person mental health assessment for all service members, whether they are active, Guard, or Reserve. Just like physical health, mental health is an essential piece of military readiness. We need to have an attitude of all in toward providing support for mental health challenges and also for the day-to-day struggles we know contribute to suicide risk. Financial problems, relationship issues, things that are never made easier by military life. The Sexton Act was named for a member of the Indiana National Guard who took his own life while home on leave from Afghanistan in 2009. Jeff and Barb Sexton, Jacob's parents, have been incredible partners in this work. Jeff spoke recently about the decision he and his wife made to speak out about military suicide. This is Sergeant Jake Sexton. Here he is in his Humvee. Here he is serving as well. His parents, Jeff and Barb, said, actually this was Jeff in particular, his dad, who said, I had three choices. I could crawl into a corner, or I could crawl into a bottle, or I could stand up and fight. It's not been an easy job, but it's something I feel my wife and I have to do. The Kieslings and the Sextons are courageously telling their stories to help prevent any more families from going through this nightmare. Congress needs to continue to answer their call. This is an issue we cannot let up on because there's so much more important work to do. This year, we're taking the next step in the continuum of care, focusing on improving the quality of and access to mental health care through Department of Defense providers, VA providers, and private community providers. This year, we introduced the Service Member and Veteran Memorial Health Care Package. 3 bills, each improves access to quality mental health care for service members and veterans. The care package aims to improve mental health care by focusing on direct care providers at DoD and VA, community providers right in your own town, and the training of physician assistants as mental health providers. I want to thank Chairman McCain and Senator Reid for working with me to include elements of the care package in the National Defense Bill, specifically those elements that deal with DoD and care for service members. I'd like to go through the care package provisions in the NDAA briefly and offer 2 amendments to ensure these provisions support not only service members, but also veterans. First, Section 716 is based on the first of our care package bills, the Community Provider Readiness Recognition Act. It's co-sponsored by my friend, Senator Joni Ernst, and it creates a special military-friendly designation for providers who choose to receive training in military culture and the unique needs of service members and military families. Providers who receive this designation would be listed in a regularly updated online registry, allowing service members to search for designated providers in their area. It's inspired by the STAR Behavioral Health Provider Network, a program that Purdue University back in Indiana, their Military Family Research Institute, built to train providers to better understand military culture and medical treatments. By designating a provider as part of the STAR Behavioral Health Network, it helps service members and their families make informed choices about where to seek care. This can easily be translated on a national scale so that service members, veterans, and their families know which private mental health care providers are well-suited and trained to treat them. Second, Section 713 of the NDAA is drawn from another care package bill, the Military and Veterans Mental Health Provider Assessment Act, co-sponsored by my friend, Senator Roger Wicker of Mississippi. This legislation requires all DoD primary care and mental health providers that they have received evidence-based training on suicide risk recognition and management, and that their training be updated to keep pace with changes in mental health care best practices. It also requires DoD to report to Congress on the military's current mental health workforce, the long-term mental health needs of service members and families, and how we ensure that DoD meets those needs. Finally, it requires the Department of Defense to bring us a plan to assess mental health outcomes in DoD care, variations in outcomes across different DoD healthcare facilities, and barriers to DoD mental health providers, implementing the best clinical practice guidelines and other evidence-based treatments. Finally, by including elements from the Frontline Mental Health Provider Training Act, co-sponsored by my friend Senator John Bozeman from Arkansas, the NDAA calls on the Department of Defense to train physician assistants to specialize in psychiatric care in order to help meet the increasing demand for mental health services among service members and their families. We are also working to extend the same spectrum of care to our veterans, and we are working towards a hearing on the corresponding veterans bills for this mental health care package in the months ahead. These are smart, bipartisan provisions that address one of the most serious challenges facing our military, our veterans, and our country. We must improve the mental health care at the Department of Defense, in the Veterans Administration, and at private community providers, from Ellsworth, Maine, to Evansville, Indiana, to the shores of California, so they are better able to serve our service members, veterans, and their families. It is absolutely essential that we have coordination and continuity for service members and their families as they transition to veteran status. I'll leave you with a couple of brief thoughts from 2 brave Hoosiers I have had the privilege to know and have gotten to know well. Jeff Sexton Jacob's dad, put it this way. It's one thing to lose someone you love in the war. It is a whole other thing to lose them to the war. And Greg Kiesling, Chancellor's dad, he concluded this. The bottom line is I don't want anybody else to go what my family has gone through. We must act, and we must act now before any more families have to experience this loss of suicide. I urge all of my colleagues to support the care package provisions for service members and to later extend them to our veterans who need their help and who need them to stand up for them. Thank you, Mr. President. I yield back.